Hello, my name is Yvette Caicedo, and I'm going to speak to you about trauma-focused cognitive behavioral therapy for kids. This treatment is for children that have experienced trauma or type of crises from the ages of 3 to 18 years old. Trauma and crises can occur at any time in our lives, and especially if you are a parent, it can happen for your children. This video is to inform you as a parent, as a therapist, and as someone who wants to educate themselves on this serious subject. A crisis can occur, for example, molestation, 1 in every 10 families. Trauma-focused cognitive behavioral therapy can assist in the healing, psychoeducation, and the coping skills for these crises. Trauma-focused behavioral cognitive therapy is also known as TFCBT. It can be anywhere from 12 to 16 sessions for the children. 80% of children who have had TFCBT show significant improvement with this treatment. This treatment will create a safety area for the child who's had significant emotional problems caused by the trauma, such as symptoms of post-traumatic stress disorder, fear, anxiety, or depression related to traumatic events. This treatment involves not just the child, but involves the parent and the family, as long as they are not the perpetrator. The treatment can also assist in the families in healing and understanding. The session can be split into 30 minutes with the child and 30 minutes with the parent. And also that could just be one session. And then the other session, they spend the whole hour where the whole family is together. The session will help have the child share the trauma narrative with the parent. It's communicating, educating, and healing. Educating the parents and helping them conceptualize the trauma that has occurred. Informing parents that kids that experience trauma may also experience behavioral issues also due to the trauma, and helping them deal with the behavioral issues, as well as what the parents are dealing with themselves, with the trauma that the child has been exposed to. Empowering both the parent and the child by psychoeducation is building strengths. It's a technique treatment is used called gradual exposure. It's helping them process the story on what they remember. They can face these memories in safety so they can break the trauma of memories and distress. Get a sense of what they felt during the trauma, and looking for unrealistic thoughts and helping them understand is very important, is not letting the child blame themselves. Now, when I say unrealistic thoughts of the child has of the trauma, is a child can be subjected to this trauma, and it goes over in their brain and over and over and over of maybe they're scared of the dark, or they never want to go in a car ever again, or they're afraid to stay at grandma's house or be away from the parents. Is taking those unrealistic thoughts, helping them conceptualize those unrealistic thoughts, and seeing the big picture of where there is a safe environment. This type of therapy first creates a safe environment, like I spoke about before, for the child. It will also psychoeducate the child on safety skills to avoid similar situations in the future, because it has been proven in research that due to a child being subjected to a certain type of trauma, like molestation or rape, is that they can be subjected to it again. They can be a victim of this again. Is teaching the child not to be a victim, is empowering the child. The key points to remember while experiencing TFCBT is creating the safe environment like we spoke about earlier, collaborating with the parent and the child in an open situation, is the gradual exposure. It's little by little speaking about it, maybe not directly about the trauma. Psychoeducation for both child and parent, so parent can also conceptualize of what happened to their child and deal with the behavioral issues that may follow. And also to teach the child, which is very important, is not to blame themselves. Something they did or something they wore or any other reason why the child would blame themselves. That adult behavior is adult behavior, and the adult should be blamed and be at fault for that type of behavior, and the child did not ask for it. Lastly would be coping techniques. And there would be things like such as taking a deep breath for the child, counting to 10, a way the child can handle the behavioral issues that have come with this trauma when they become upset and they don't really know why they're upset. I will demonstrate a few scripts the therapist speaks about to the child about during the session and also through the parent. First is getting the parent on board. And I just wanted to give you a quick synopsis of that script. It's really important for us to provide your child with correct information about healthy sexuality. We want to give her information so that he or she can feel good about his or her body and positive about sexuality. If child's been sexually abused, you can say, unfortunately, she's been given some incorrect information because of her sexual abuse. For non-sexually abused kids, you can say, a lot of kids have incorrect information about sex in their bodies, and this can be very confusing. You may worry about putting ideas in his or her head, but know a lot more than we think. The child really does a lot more what they think. So we're educating them on thoughts that they may have already. If child's been sexually abused, you can say, unfortunately, even though it's hard to think about, the sexual abuse has made your child aware and probably confused about sex. This might, for a lot of children, might be their first sexual experience. You may also be worried that if we talk about sex, we're kind of giving permission to go out and have it. What's important to understand is your child is going to be curious about sex anyways. And us talking to him or her about it isn't going to create the likelihood that she'll be sexually active. It's not going to increase it. We're not just going to give her facts about sex, but we're going to work together to be sure that we give your child correct information and also share your family's values about sexuality. It's being able to collaborate with the parent, the therapist, and be able to speak to the child of what their family values were, and not based on their sexual experience on the trauma that has occurred. And that's for the parent script. We talked about psychoeducation for children. And I just wanted to give you a little bit of script sexual education for the child. It's body awareness. Your body is very special. And it's okay to have sexual feelings. When you become an adult and you can enjoy having sex with someone who you love, that will be a very special thing. Sex with someone you care about is a very positive, loving thing. And that's, again, showing the child that sex is okay. And it's not something that you're punished for. Just to summarize, TFCBT, which is trauma-focused cognitive behavioral therapy, is the treatment that focuses on communication, education, and healing for both the child and the parent. Thank you very much.